As the world waits for a coronavirus vaccine, the U.S. is trying various methods to contain the virus. That includes what's known as contact tracing. But last week, the nation's top infectious disease doctor, Anthony Fauci, told reporters contact tracing is, quote, not working.
What we're dealing with right now is community spread in the context of a substantial proportion of the people who are getting infected do not know they're infected, they're not symptomatic, they're asymptomatic individuals. The classic paradigm of identification, isolation, and contact tracing to actually contain that is very difficult to make that work under those circumstances. You superimpose upon that the fact that even with identification, isolation, and contact tracing, often the dots are not connected.
For more on all this, I want to bring in Bryan Walsh. He is a Future correspondent for Axios and recently wrote an article called Why Coronavirus Contact Tracing is Failing. Bryan, good to have you with us. First of all, remind us what exactly contact tracing is and why it's so important.
Contact tracing involves trained staff contacting people who have tested positive for a disease, in this case, COVID-19, and trying as much as possible to determine who they may have been in contact with, both in terms of how they would have contracted the disease in the first place, but even more importantly, to identify their close contacts so those people can be identified, put into self-quarantine, self-isolation, and in doing that, really try to slow or break the spread of transmission for a disease.
Well, in your reporting, you note that it's recommended the U.S. employ at least 99,000 contact tracers. But the CDC director, Robert Redfield, says we have just 27 to 28,000. What are some of the impacts of not having enough contact tracers?
Well, it's simply a matter of not being able to follow up, not being able to really keep pace with the outbreak. And I should say, that 99,000 number that we're shooting for is probably is really less than we actually need. Tom Frieden, who used to run the CDC, has said we need 300,000. That seems reasonable to me. But if you don't have enough staff, you can't keep up with the pace of the outbreak. You can't investigate cases. Things fall through the cracks. You don't have people who can call back in the event that you can't get in touch with someone. It just makes it much harder to do what's already a really difficult job.
Yeah, well, even with enough contact tracers, the strategy of tracking the virus can still fail. Why is that?
Well, for one thing, this virus is incredibly hard to find. As we discover, increasingly it can be spread by asymptomatic people who aren't really showing symptoms. It's kind of hard to identify those people if they don't even appear sick. They might not get tested. And then add to the fact that there may be 10 times as many people who have actually had this disease as have been confirmed cases, which means that's just far greater as a size than any outbreak we've ever had to try to contact trace before. We often look for things like TB, HIV, other STDs. Those are just smaller outbreaks. This is so vast that trying to really do that detective work is incredibly difficult. And then it's also sometimes really hard to actually reach people and get them to actually talk to you.
We so often reach for technology for things that are overwhelming like this. What about app-based contact tracing? There was a lot of talk about that. Could that work?
There was a lot of talk about app-based contact tracing. It hasn't really borne out so far. I mean, Apple and Google really, they cooperated on a standard that could have made it a lot easier using Bluetooth. You've had a few states, definitely different countries, that have tried out experiments with app-based contact tracing. It just hasn't worked, in part because people haven't really wanted to download these apps, and they're not being required to. So, there are legitimate concerns about privacy. Those same issues come up during person-to-person contact tracing. But, if you can't get people to actually download the apps, you're not going to be able to put them in place. And then, we don't know how effective they would ultimately be. This would be something we've never tried before. But, I think it gets back to the real core here, which is that if people don't have trust in the government and those who might be doing the tracing, they're not going to cooperate. If they don't cooperate, you really can't do this.
Right, that public trust is so essential in tackling a problem like this. Bryan Walsh for us. Bryan, thank you very much.
Thank you.